Welcome back to MLT 240. This is part 2 for the virology lecture. We're going to go over some different types of viruses, and we're going to discuss if they're either DNA, RNA, and whether they're either double-stranded or single-stranded. First off, we're going to talk about some examples of double-stranded DNA viruses. We're first going to talk about pox virus. It's in the Poxviridae family. Smallpox was eradicated in the 1980s. The population is now susceptible. It remains a potential bioterror weapon. It is the largest human virus, and it has a characteristic brick shape as far as its structure. Next, we have the herpes virus. It includes the herpes simplex viruses, HSV1, 2, and there's HSV6 that's also in this category. HSV1 is the oral herpes, and it causes cold sores on the lips and face. HSV2 is the genital herpes. It causes sores in the genital area of men and women. HHV6 is also known as roseola, and it's benign, and it's a childhood disease, and it causes a rash and fever. And we're going to see an image of roseola on the next slide. Here is the rash from the roseola virus, or HHV6. Also, a double-stranded DNA virus is the human papillomavirus, or HPV. This is abnormal tissue growth or genital warts. It's the most common viral sexually transmitted infection. It's the cause of about 99% of both cervical and prostate cancers. It's estimated that about 80% of sexually active adults have been affected by one or more genital HPV strands at some time. The majority of infected people suffer no ill effects and never know that they have been infected, but they may be able to infect others. Other examples of double-stranded DNA viruses include our cyclomegaliovirus, or CMV. Most of us have it, can cause blindness, even death, in people with suppressed immune systems. Next is the Epstein-Barr virus, or EBV. It causes infectious mononucleosis, or the kissing disease, or mono, and has been implicated in the development of Burkitt's lymphoma, which is a cancer. Also, it's been implicated in chronic fatigue syndrome and Hodgkin's disease. And finally, varicella zoster's disease, or VZV. It causes chicken pox, the varicella, the first time, and then shingles the second time, the zoster, usually in adulthood. Here's an example of what shingles looks like on the skin from the varicella zoster virus. Next up are examples of single-stranded DNA viruses. The Parvoviridae family falls under single-stranded DNA. These are the smallest of the DNA viruses. Parvovirus B19 is the principal pathogen in this family. Infections range from asymptomatic to potentially fatal. The most commonly recognized syndrome is erythema infectiosum, which is more commonly known as fifth disease or slap cheek disease, and we'll see an image of what that looks like on the next slide. But symptoms include fever, headache, malaise, with respiratory issues and GI symptoms. A rash gives a slap cheek appearance, then spreads to the trunk and limbs. It occurs more commonly in children than adults. It can last as long as 2 weeks and can recur after exposure to sunlight and heat. Most infections will occur in children and adolescents, but 85% of adults will be seropositive by the age 65, meaning in a blood test, the virus will show up in 80% of adults by the time they're 65. So this is the classic slap cheek rash on a child with fifth disease or slap cheek disease. Next are examples of double-stranded RNA viruses. The Rioviridae family falls under this category. The genus Retrovirus is a common cause of gastroenteritis in infants and children. The distribution is worldwide with an estimated 611,000 deaths per year. The cultivirus causes Colorado tick fever, which is similar to dengue fever, or it's a dengue-like infection in the western U.S. and Canada. And just to remind you, dengue is caused by mosquitoes and can cause headache, joint pain, and a rash. Now for single-stranded RNA viruses, we have the genus norovirus. It's the most common cause of infectious gastroenteritis in the U.S. with about 23 million cases annually. Then we have our coronavirus family that causes SARS, MARS, and our COVID-19. The family Filoviridae encompasses the Marburg virus, which causes Lake Victoria virus. It's rare, but can be deadly. It has a high mortality rate, and the high mortality rate because it causes hemorrhagic fever and capillary leakage. It's very similar to Ebola. It was named after a West German town. And then, of course, the Ebola virus is also in this family. The family of Flaviviridae is next. It encompasses the Zika virus, and the mosquito is the vector for Zika virus. Also, West Nile virus, which the mosquito is also the vector, and the dengue virus, which causes dengue fever and dengue hemorrhagic fever. Here's a little bit more about West Nile virus. Make sure to protect yourself from mosquitoes. Use repellent. Empty anything that holds water to try to reduce the number of mosquitoes. Also wear long pants. Most people infected won't get sick, but 20% of people will get sick. Less than 1% of infected people will end up getting very sick from West Nile. Used to not hear very much about West Nile at all, but in the last several years, West Nile has become more and more prevalent. More examples of single-stranded RNA viruses include influenza viruses. Our influenza viruses are distinguished using two major structural proteins, a matrix protein and a nucleoprotein, which places the viruses into three major genres, either influenza A, influenza B, or influenza C. And these have worldwide distribution and have seasonal occurrences. And it remains one of the most crucial health problems worldwide are influenza viruses. There was a pandemic of 1918 to 1919 that killed an estimated 20 to 50 million people. In 6 different years from 1972 to 1995, flu deaths in the U.S. exceeded 40,000. A typical flu season in the U.S. hospitalizes almost 200,000 and kills about 36,000 people. So influenza is still a huge issue for us as far as the world population and even a U.S. population. The key to the persistence of influenza is antigenic variation. There's the antigenic drift and the antigenic shift. The antigenic drift is minor changes in the antigenic structure and mutations that accumulate, and occurs in all three influenza viruses. The antigenic shift occurs when the surface antigens change drastically. This results in new H and N antigens. The H and N antigens of influenza continually change. The CDC and the WHO make recommendations on the composition of the virus several months before the flu season begins, usually containing 2 different strands of flu A and a single strand of flu B. The influenza B infections occur less than flu A. So basically what that's saying is the CDC and the WHO use the information and the statistics that they have to come up with the best vaccine they can to help ward off the influenza strain that's most likely coming. Influenza is spread through aerosolized inhalation and is characterized by rapid onset of malaise, fever, myalgia, non-productive cough, and pneumonia. As far as diagnosis, we can use PCR and antigen detection. Those are the most common methodologies that are used. Other examples of single-strand RNA viruses include the mumps virus, which is or has a global distribution. It's spread through droplets of infected saliva. It causes acute illness, producing unilateral or bilateral swelling of the parotid glands, which are salivatory glands, but other glands may also be affected. Usually seen in children and adolescents, and there's usually long-lasting immunity, and there is a vaccine available for mumps. Next is the measles virus. It also has worldwide distribution. It is found in temperate zones. Epidemics usually occur in winter and spring. It was once one of the most viral diseases in children in the U.S., but through immunization programs began in the 1960s, around 1963, the cases have dropped dramatically. This virus is highly contagious. It's spread through aerosolized droplets. Symptoms that occur is abrupt onset of sneezing, runny nose, cough, red eyes, and rapidly rising temperature. After onset, there's a rash 2 to 3 days on the head and trunk, and irregular red spots with bluish to white specks in the center on the oral mucosa called Koplik spots, and we're going to see what that looks like here in just a second on the next slide. Here are the white spots on the oral mucosa caused by the measles virus. Next, for single-strand RNA viruses is the respiratory syncytial virus, or RSV. It causes croup, bronchitis, bronchiolitis, and interstitial pneumonia. It's the most common cause of severe lower respiratory tract disease in infants and children worldwide. The infection does not confer immunity. Multiple infections can occur throughout life, and it can be more severe in older adults, an immunocompromised patient, or those with cardiac problems. The specimen of choice for RSV is the nasopharyngeal swab. Still moving on with our single-stranded RNA viruses, Coxsackie or Coxsackie-A disease is also referred to as hand, foot, and mouth disease. This is a common childhood illness, and most cases of infection are asymptomatic or only cause mild symptoms. Coxsackie-B virus can also cause infections and can cause things like myocarditis and infectious pericarditis. Also under single-strand RNA is rhinovirus. It's the most common viral infective agent in humans, and it's the causative agent of the common cold. Also, polio is a single-strand RNA virus, and it's also the smallest human virus. We have seen some reemergence of the polio virus in recent years with some anti-vaccine movements. The family Retroviridae falls under the single-stranded RNA viruses. HIV was identified in 1994 and was the cause of a widespread epidemic of severe immunosuppression called acquired immunodeficiency syndrome, or AIDS. AIDS is a disorder of cell-mediated immunity characterized by opportunistic infections, malignancies, neurologic dysfunction, and a variety of other syndromes. AIDS is the most severe manifestation of a spectrum of HIV-related conditions. Rabies is also a single-stranded RNA virus. Rabies is caused by several strands of virus in the genus of Lyssavirus. It's estimated about 55,000 people die annually worldwide. Dogs or dog bites are implicated in about 99% of rabies deaths among humans. In the U.S., human cases are rare. There's about 2 cases per year, but it is an emergent infection in animals. All mammals are susceptible to rabies, though it's more common in wild animals. About 92% of cases are in wild animals. Confirming rabies in human cases. It depends on the lab IDing and determine whether the animal that has bitten the human has rabies. So the animal is killed, the head is removed, and that head of the animal is sent to a reference lab for testing. Rabies cannot be successfully treated once symptoms present, though post-exposure prophylaxis is 100% if given immediately after the bite. So even if a rabies case is suspected, you go ahead and start giving the post-exposure prophylaxis just to be on the safe side. Even if that animal comes back negative for rabies, that patient is more than likely going ahead and started those post-exposure medications just to be on the safe side. Other examples of single-strand RNA viruses include La Crosse or California encephalitis. It's carried by an arthropod vector. Crimean Congo hemorrhagic fever. It affects the vascular endothelium in the liver. Hantavirus, which is carried by rodents, mainly mice, and it affects the peritoneal cavity, the kidneys, the thoracic cavity, or the lungs. And this one has recently been in the news. And Rath Valley fever that targets the brain, the liver, and causes encephalitis and hepatitis. More single-strand RNA viruses, Eastern equine encephalitis or triple E. You can find this one in people, but you mainly hear about it in horses. It's primarily in the eastern U.S. The mortality rate is 40%. Then you have Western equine encephalitis. It's milder than triple E, and the mortality rate is about 3%. The vector for both Eastern and Western equine encephalitis is a mosquito. Next is rubella. It's also known as German measles. It's transmitted by respiratory droplets. It multiplies in the lymph nodes. A macular-papular rash develops. You have congenital infections. Cataracts can form, can have glaucoma, deafness, heart abnormalities, mitral regurgitation, or even death. Next, we're going to talk about our hepatitis viruses. Hepatitis viruses are usually used to describe infections caused by agents that primarily target tissue in the liver. At least 5 different hepatitis viruses have been recognized: A, B, C, D, and E. Specific diagnosis can only be made in the laboratory. Symptoms include anorexia, nausea, vomiting, right upper quadrant pain, and raised liver enzymes such as AST and ALT. And the hallmark of an hepatitis infection is jaundice, or the yellowing of the skin. And we're going to look at the next slide to see exactly what jaundice looks like. So here is a comparison of a healthy patient versus a jaundice patient. So a jaundice patient, the whites of the eyes and the skin are going to have a yellow appearance. So let's first talk about hepatitis B, or HBV. It can be characterized as double-stranded or single-stranded DNA. Hepatitis B virus, the antigens are DNA. The hepatitis surface antigens are coated with a protein, and that indicates an active hepatitis B virus infection. The hepatitis C antigens, or core antigens, are the inner core proteins, and the hepatitis B E antigens is the ones that are secreted or secretes a protein, and the function is really unknown. And the antibody for hepatitis B is the IgM, and it confirms the diagnosis of an acute infection. And the antibody BS indicates the convalescence or the immune status. It means that they've had hepatitis B in the past. Hepatitis A is categorized as a single-strand RNA. It's transmitted via the oral fecal route. It's self-limiting. Though the recovery can take months, it has a low mortality rate with no chronic liver damage. IgM to hepatitis A virus is the most common diagnostic method. There is a vaccine that is available for hepatitis A. Hepatitis D virus requires hepatitis B virus for replication. Infections are rare, but usually severe and results in acute disease. And sometimes the fatality rate is about 5% and progresses to cirrhosis in about 2/3 of cases. Hepatitis C is a single-strand RNA virus. It affects an estimated 71 million people worldwide, and it's the leading cause of liver transplants. 75% of people affected with hepatitis C develop chronic hepatitis C. About 50% of patients become long-term carriers, and about 20-30% develop chronic cirrhosis. Hepatitis C is a major risk factor for hepatocellular carcinoma. There is no vaccine, but there is a cure. The last category that we need to talk about is prawns. These are really not viruses. These are proteinaceous infectious particles. Basically, proteinaceous means they're consistent of or containing proteins, and they cause a group of diseases in animals called transmittable spongiform encephalitis, or TSEs. Some examples of prawn diseases are Creutzfeldt-Jacobs disease, or CJD, in humans, Kuru's in humans, Scrapie's disease in sheep, chronic wasting disease in deer and elk. It used to be more out west, but now it's actually in North Carolina. And bovine spongiform encephalitis, or BSE, in cows, also known as mad cow disease. The last slide and information that we need to talk about is antiviral drugs. The first successful antiviral is encyclovir, which is effective against herpes virus infections and varicella. AZT is the first antiviral drug to be approved to treat HIV, but many others are available now. Fluconazole works against rhinoviruses, which of course cause the common cold. Amantadine and rimantadine can prevent infection and reduce severity of symptoms if administered within the first 48 hours of onset infections. It's only effective against flu A, but Tamiflu and Relenza are effective against both flu A and flu B. This concludes our lecture on virology and viruses. If you need any further clarification on anything, please don't hesitate to reach out.